Have you ever gone in for a routine blood test, expecting everything to be normal, only to receive results that left you confused or worried? Maybe your cholesterol came back high, your liver enzymes were elevated, or your blood sugar suddenly jumped into the pre-diabetic range even though nothing felt wrong. Well, you're not alone. This happens to millions of people every year, and not because something is wrong with their bodies, but because something went wrong before the test. Let me tell you a true story. Just last month, a 5-year-old marathon runner had his annual blood work done. Everything should have been perfect. But when the results came back, his liver enzymes were flagged as dangerously high. That one result led to weeks of follow-up appointments, extra tests, and a lot of unnecessary stress. And the cause? He had gone for a long run just a few hours before his blood draw. That's it, nothing more. His liver was perfectly healthy. The test was just reflecting the temporary effects of intense exercise. Now imagine how often this kind of thing happens, especially to older adults who may be on medications, supplements, or managing chronic conditions. A recent study from Johns Hopkins University looked at over 500,000 blood test results and found that nearly 40% showed inaccurate readings caused by simple, preventable mistakes in the 24 to 48 hours before the test. And these weren't small differences. We're talking about false readings that led to misdiagnosis, unnecessary medications, and sometimes completely missing real problems that actually needed attention. Here's the good news. Every single one of these mistakes is avoidable with a little knowledge, a few easy changes, and less than 10 minutes of your time. That's what this episode is all about. Whether you've had a confusing result before, or just want to make sure your next blood test tells the truth about your health, this guide will walk you through the 10 most common mistakes people make and exactly how to avoid them. Let's start with the mistakes you might be making without even knowing it. Let's begin with the kinds of mistakes you might never realize you're making. These are the ones that feel innocent, maybe even healthy, but they can quietly distort your blood test results in ways that completely misrepresent what's actually going on in your body. The first has to do with medications and supplements. Many older adults take a combination of prescriptions, over-the-counter pain relievers, and vitamins every day. But some of those seemingly harmless items can interfere with your lab results more than you'd expect. One of the biggest culprits? Biotin. That's the vitamin often found in hair and nail supplements. High doses of biotin can throw off more than 40 different lab tests, including ones used to measure thyroid hormones, vitamin D, and even markers used to diagnose heart attacks. According to the FDA, people taking 5 to 10 milligrams of biotin daily can end up with blood results that are dangerously misleading. But it's not just biotin. High-dose vitamin C can interfere with cholesterol and blood sugar levels. And something as common as aspirin can affect platelet function for days. That's why it's essential to talk with your doctor before your test. Create a full list of everything you take, prescription or not, and bring it with you. Never stop a prescribed medication without asking, but do ask if you should pause any supplements a few days beforehand. Sometimes, just skipping one pill for 24 to 72 hours can make your blood test far more accurate. Now, here's another hidden factor when you get your blood drawn. Most people think timing doesn't matter, but your body's hormones, blood sugar, and even iron levels follow a 24-hour rhythm. For example, cortisol is highest early in the morning and lowest in the evening. Testosterone and iron levels are also naturally higher earlier in the day. If you get tested at 3 p.m. instead of 8 a.m., your results might look off even though everything's working fine. That's why experts recommend getting your blood tests done between 7 and 10 a.m. and sticking to that time window every time, especially if you're tracking results over months or years. And finally, we come to a mistake that catches even the healthiest folks off guard: working out too close to your test. You may be proud of your morning jog or gym session, but vigorous exercise before a blood draw can seriously alter your lab values. Studies show that intense workouts can raise muscle enzymes like creatine kinase by up to 300%. Liver enzymes can also spike. Even your white blood cell count, blood sugar, and inflammation markers can go up, mimicking infection or disease when you're perfectly fine. The safest move is to avoid strenuous workouts for at least 48 hours before your test. Light walking is okay, but anything that makes you sweat or breathe heavily should wait until after the blood draw. And if you do happen to exercise beforehand, let your doctor know. It could help them read your numbers more accurately. When you put these three together, medications, timing, and exercise, you start to see how easily test results can be influenced by things that have nothing to do with your true health. But the best part? Each of these is totally within your control. Let's move on to another group of mistakes. These ones are tied to our daily habits. They're part of how we live, how we eat, drink, and feel. And because they feel so ordinary, we often don't realize just how much they can impact the outcome of a simple blood test. The first one might surprise you: drinking alcohol in the days leading up to your test. Even a single glass of wine with dinner can skew your results more than you'd think. According to the National Institute on Alcohol Abuse and Alcoholism, alcohol can affect liver enzymes, increase triglycerides by up to 30%, and throw off blood sugar levels for several days. It doesn't stop there. Alcohol also depletes nutrients like B vitamins and magnesium, while falsely increasing iron levels. In one study, people who avoided alcohol for just 72 hours before testing had significantly better triglyceride numbers. Some saw a drop of more than 50 points. That difference alone could mean the difference between "you're fine" and "you need medication." If you're getting a comprehensive metabolic panel or liver test, doctors recommend cutting alcohol for a full week beforehand. And it's not just wine or beer. Watch out for cough syrups, cooking wines, or even fermented foods that contain trace alcohol. Next is something that seems so basic we rarely think about it: hydration. But being slightly dehydrated can make your blood appear more concentrated, raising values like creatinine, sodium, and hemoglobin. You might look like you have kidney problems when really you just needed a glass of water. On the flip side, drinking too much water, especially right before your test, can dilute your blood. In a study at UCLA, patients who drank more than a liter of water in the hour before their test showed falsely low sodium in over 1/3 of cases. Too little or too much water, either way, your results get distorted. The best balance? Drink about 16 to 24 ounces of water slowly in the 2 hours before your test. Not all at once, just enough to keep your urine pale yellow, not too dark, not too clear. And finally, there's one mistake that doesn't involve food or drink at all. It happens in your mind. Many people experience stress or anxiety when they're in a medical setting, especially when needles are involved. It's called the white coat effect. And that mental stress doesn't just make you uncomfortable, it actually alters your blood. Studies from Harvard Medical School show that anxiety can raise cortisol levels by up to 45%, elevate blood sugar, and increase white blood cell counts, mimicking signs of inflammation or infection. In one case, a patient was nearly diagnosed with prediabetes during a stressful test, yet 2 days later, in a calmer state, their numbers were back to normal. That's why it's so important to arrive early for your appointment. Take a few deep breaths and allow your body to settle. Some people find it helpful to listen to calming music while they wait, or to ask for a lying down position during the draw. Whatever helps you stay calm, it helps your results stay accurate too. So whether it's a drink, a bottle of water, or a feeling you didn't even realize you were carrying, these everyday habits have the power to change your lab report. But once you understand them, you can make simple choices that lead to clearer answers. Sometimes it's not what you eat or drink that causes trouble, it's what you do with your body in the moments leading up to the test. The next two mistakes may seem small, but they can create surprisingly big changes in your blood work, especially when your doctor is looking at the fine details. Let's start with something simple, your posture. Most of us don't think twice about it. We walk into the clinic. Maybe we've just climbed the stairs. Maybe we're still catching our breath. But did you know that even standing up after sitting or lying down can change the composition of your blood? Research published in the Journal of Clinical Pathology found that when patients stood up after resting, protein levels rose by 10%, calcium by 6%, and cholesterol by 8% just because of fluid shifts in the body. When you move, gravity pulls fluid into your tissues, concentrating the remaining blood. It's temporary, but it matters. Even clenching and unclenching your fist, something people often do to help the blood flow, can raise potassium levels by up to 20%. That's enough to trigger concern for heart problems or electrolyte imbalances that don't actually exist. So what should you do? Keep it simple. Arrive early. Sit quietly for at least 10 to 15 minutes before the draw. Keep your arm relaxed and supported at heart level. Don't pump your fist unless the technician specifically asks you to, and even then, do it gently and only once or twice. Now let's talk about the second small mistake: using the wrong arm. If you've recently had an IV, a vaccine, or any kind of injection, that arm should not be used for blood draws. Why? Because the fluids or medications may still be affecting the tissues and could leak into the sample, giving false readings. The CDC found that up to 10% of abnormal hospital blood tests were due to drawing from an arm that had recently received fluids. One patient, for instance, had a blood sugar reading of over 400, suggesting a medical emergency, when in fact it was just glucose from a dextrose IV being pulled into the sample. The solution is simple. Always tell your nurse or technician about any recent procedures or injections. If you've had surgery, like lymph node removal for breast cancer, that arm should never be used. When in doubt, choose the non-dominant arm and make sure it hasn't been used for anything medical in the past couple of days. These little adjustments, how you sit, how you move, and which arm you offer, can make the difference between an accurate diagnosis and unnecessary concern. It takes only a moment to pause and prepare, but the benefits can be lasting. Now let's talk about a mistake that happens not minutes before your test but the day before. What you eat in the 24 hours leading up to a blood draw may not seem important, especially if your doctor didn't tell you to fast. But the truth is, even when fasting isn't required, your food choices can dramatically impact your results. Take fatty foods, for example. A groundbreaking 2023 study from Stanford University found that eating a high-fat meal the night before a blood test raised triglyceride levels by an average of 25%. In some cases, the increase was over 40%. That's enough to push someone from a normal range into a flagged result, possibly leading to a prescription they don't actually need. But it's not just fat. Red meat, especially in large portions, can increase creatinine levels, one of the main markers used to assess kidney function. In one reported case, a bodybuilder who ate 2 pounds of steak before his blood test was nearly diagnosed with stage 2 kidney disease. When he retested 48 hours later, without meat in his system, his results were completely normal. Sugar is another troublemaker. Eating sweets or drinking sugary beverages within 12 hours of your test can elevate your blood glucose by 15 to 20 points. That difference alone could shift someone from the healthy range into pre-diabetic territory. And it doesn't stop with sugar. Even artificial sweeteners can trigger an insulin response in some people, which may alter several other blood markers. So what's the best approach? Keep it simple and balanced. In the 24 hours before your test, eat meals that are light and nourishing, things like cooked vegetables, lean protein, and whole grains. Avoid fried foods, heavy meats, sugary snacks, and alcohol. If you're being tested for cholesterol or triglycerides, some experts suggest sticking to your normal diet for 2 weeks to get an accurate baseline, but avoiding high-fat meals in the final 24 hours to reduce immediate distortion. One extra tip: Keep a short food diary of what you eat the day before your test. It doesn't have to be complicated, just a list of meals and times. Bring it to your appointment or mention it to your doctor. That context can help explain unusual results and may save you from having to redo the test later. In the end, what's on your plate today could echo in your lab report tomorrow. And the more intentional you are, the clearer your health picture becomes. Now we come to what might be the most common and potentially most harmful mistake people make before a blood test. It's something so simple in theory, yet so misunderstood in practice: fasting. We've all heard the instruction, don't eat anything for 8 to 12 hours before your test. But what exactly does that mean? For many people, fasting simply means skipping breakfast. But in reality, even tiny things like a splash of cream in your coffee, chewing sugar-free gum, or taking a supplement during the fasting window can be enough to alter your blood results. A large-scale study in 2024 examined over 1 million blood test samples and found that 43% of errors came from improper fasting, more than from any other single mistake. Let's break it down. When you fast, the goal is to give your body a consistent, neutral baseline. But if you add calories, even just a few, you interrupt that baseline. One patient in a Mayo Clinic report had a triglyceride reading of over 400, suggesting a serious risk for pancreatitis. It turned out they had taken a fish oil capsule the morning of the test. When retested without the supplement, their levels dropped back to a normal 150. And it's not just what you eat, it's also how long you fast. Fasting too short, like only 6 hours, doesn't give your body time to stabilize. But fasting too long, more than 16 hours, can also create false results. Extended fasting causes your body to produce ketones and start breaking down muscle for energy. This can raise certain blood markers and even increase blood sugar levels, ironically making you look pre-diabetic or malnourished when you're actually not. So what does proper fasting really look like? Stop all food and calorie-containing drinks exactly 10 to 12 hours before your scheduled test. Do not eat or drink anything except plain water during that period. That means no gum, no flavored water, no breath mints, and no supplements unless specifically approved by your doctor. If you take medication, ask your doctor in advance whether to take it during the fast. Some medications are okay, others may need to be paused. Schedule your blood draw for early morning if possible, so most of the fasting time occurs while you're sleeping. Set a reminder on your phone for when to begin fasting and remove snacks or drinks from easy reach to avoid breaking the fast by accident. And if you do happen to slip up, whether it's a sip of coffee or a bite of something small, it's okay. Just be honest. Let your doctor or technician know, or better yet, reschedule the test to ensure your results reflect your real health. Because your blood test is more than just numbers, it's the foundation for important decisions. And if that foundation is built on a shaky fast, the entire picture can become distorted. So now you know. 10 simple mistakes, some as small as what time you schedule your test, or whether you had a glass of wine 2 nights ago, can completely change what your blood says about you. These aren't just minor details. They're the difference between getting a clean bill of health or walking away with a prescription, more tests, or a diagnosis that may not even apply to you. But here's the empowering part. Every single one of these mistakes is within your control. You don't need expensive equipment. You don't need medical training. All it takes is a little preparation and awareness. Knowing what to do in the 24 to 48 hours before your blood test gives you the power to make sure the results reflect your real health, not just a momentary snapshot affected by a meal, a supplement, or a stressful morning. So before your next blood draw, take a moment to review what you've learned here. Avoid heavy meals, skip the gym, get plenty of sleep, and drink just the right amount of water. Give yourself time to relax before the appointment. And above all, don't be afraid to speak up. Let your doctor or nurse know what medications or supplements you're taking, how you prepared, and whether anything unusual happened before the test. That conversation could be the key to preventing a false alarm or catching something that truly needs attention. If this episode helped you feel more informed and confident, we'd love to hear from you. Have you ever had a blood test result that turned out to be misleading? Or maybe you've made one of these mistakes before without even knowing it. Share your experience in the comments. Your story might help someone else avoid the same stress or confusion. And if you know someone who has regular blood work, especially a parent, a partner, or a friend, please share this video with them. Sometimes, the smallest changes make the biggest difference, because your health deserves to be seen clearly. And now, you know how to make that happen.